My name is Dante Downing, a student at MCC, and we are going to show how to administer an IM injection through the Z-Track method. So to begin, we're going to wash my hands and go over to the MAR to check to see if we have an order. And we do. We have an order for Rocepin 1 gram IM using the Z-Track method. And we have to reconstitute and calculate the dosage, but before we do that, I'm going to make sure that we have the right patient, the dose, the time, the route, the drug, and the documentation. And looking at his MAR and the physical copy that we have, looks like everything is correct. Now we have this, we are going to begin reconstituting and calculating the dosage. So now we're going to come over here to the med room, and to recalculate the dosage according to the vial right here, we are going to use a 5.6 milliliters of diluent to get 500 milligrams per mil. So we are going to be drawing out 2 mils total to meet that 1 gram requirement, or 1,000 milligrams. Now for that, we are going to begin. I just washed my hands again. We are going to clean the tops. Now that that's done, we are going to use this syringe to draw up 5.6 milliliters of diluent, and then go from there. So to do that, we are going to use one of our separate needles. And then make sure that all the powder is at the base, which it is. Now we take off the needle. We'll take off the cap to the needle and withdraw 5.6 mils of air out of here. Alright, and then shoot in the 5.6 mils into this one of air, and then withdraw 5.6 milliliters of diluent. We got 5.6 mils of diluent. We have no bubbles, or else I would tap them and get the bubbles out. And now that that is done, we would come back over here and shoot in the 5.6 milliliters of our solution. Usually wouldn't do that, but that's okay. Put that down, and we'll discard of this in the sharps container. Now that that is done, we are going to shake up the medication, not shake it, roll it, and allow it to dissolve. But while we do that, for the Z-Track method, there's a special way of finding the spot on how to administer the medication. So if you would follow me, we will demonstrate on a mannequin on how to find the spot. If you'd like to follow me. You would ask the patient to go on their side, and you would locate the top right here at the top of the hip, and use your opposite hand and feel that little bump, and then have your middle finger midline, and then it would be right there where my finger is, and that's where you administer the medication. And tuck the patient back into bed. And for the diluent, we used 0.9% sodium chloride. Now I'm going to wash my hands again. Double check again that the medication has dissolved, in which it has. And now that that's done, I'm going to clean the top yet again. And now that that is done, we will be using the syringe that we're going to be administering to the patient. Although we will be taking off this first needle and be putting on a new one to draw up the medication, and then we will replace it when we will be administering the med. I'm going to be drawing up 2 mils. There we go. And we already cleaned up the top. There. Recap that. It's not coming off. Discard of that, and then replace the previous needle that was on there. And now we are ready to begin. We'll introduce ourselves to the patient and go from there. Clean up my area before I go and return the medications to where I got them. And this is where I would perform my second check to make sure that our dosages match, which they do. We still have the 6 rights that we are meeting still, right patient. And now we are ready to head to the patient's room. So, coming to the patient's room.
Hello.
Hello, my name is Nurse Downing. I will be here to give you a Rocepin 1 gram intramuscular injection. We're going to do it with the Z-track method. Are you familiar with this procedure?
Yes.
Wonderful. So before we start, could you give me your full name and date of birth?
Frank F. Berter, 3/14/50.
Perfect. So before we start, I'm going to wash my hands. And don my gloves. But before I do that, I'm going to clean the site. And this is when we would place the patient on his side and then identify where to give the injection, as we did earlier on the mannequin. And then I've identified my site and cleaned the site. Apply my gloves. And we've already done our third check before we administered by using 2 identifiers. So now we are good to administer the medication. And then you'd use your hand and pull up slightly, and then identify your site once again with bevel up facing the hip, and then straight in. And then doing this still, you would grab here, and then slowly administer the medication. And then pull up. All done. And we have a safety lock on the needle. And then we would discard. And then use a cotton ball or some gauze to clean up and then assess the site. That's done. I would remove my gloves and wash my hands and place the patient in a comfortable position, and then give the patient his call light. And is there anything else that I can do for you?
No, that's great, thank you.
Alright, wonderful. So now I would go back to my bedroom, or the MAR, and document that we administered Rosefin 1 gram IM using the Z-Track method, and I would use D-Downing student nurse with today's date at 1400, and document that.